Today we are going to talk to you about gynecomastia surgery. The gynecomastia is an abnormal enlargement of male breast tissue. Now when people ask me about gynecomastia, there are a lot of myths surrounding it. Gynecomastia is also called male boobs or moobs these days. Well, you can see people from all age brackets coming to us with this problem. I have seen patients who are coming from the age of 14 to 15 all the way up to 55 or even 60 years. I have operated on the patients of gynecomastia in all of these age groups. You must know that the male breast tissue is almost similar to a female breast tissue. However, at puberty, there is a regression in the male breast tissue, and in females, due to the effects of estrogen and progesterone hormones, the tissue enlarges, forming a normal breast. In males, due to the testosterone, this tissue is usually not developed. However, in the condition called gynecomastia, there is an abnormal enlargement and overgrowth of this breast tissue. The common symptoms the patient comes to us with the gynecomastia is usually a pain underneath the nipples. At times, they feel a lump or a swelling under the nipple. A few men complain of just puffiness at the nipple area. And most of them are confused whether it's just fat or is it actually gland tissue. And they're confused why the swelling is happening. This swelling or the lump underneath the nipple grows very slowly over a period of years. There is no exact cause sometimes for this gynecomastia, and sometimes it is just normal. There could be an abnormal imbalance of hormones. Many times it is due to obesity. At times it could be happening in those men who are taking long-term medications related to certain heart diseases, liver diseases. You could be having some endocrinal abnormalities, and most times it is just obesity, and there is no cause really related to it. Young boys at the schooling age as well at college get quite embarrassed because of this overgrowth of the chest, and they are uncomfortable to bare their chest and uncomfortable to perform sport activities due to the heaviness of the chest. Many of them do complain of pain at the chest area. We also see patients not only in school and college, but also those who are in the adults, maybe in their 30s or even in their 40s. They realize that they are having this swelling since many years, but they are not sure what it is, so they do not come to us in the beginning. When they do come to us, we have to differentiate, is it a true gynecomastia or is it something called as a pseudogynecomastia? That is, sometimes it is only fatty tissue. Many times as the boy grows older and they come into their 20s, they lose most of their baby fat, and they notice that some part of the swelling underneath the nipple area regresses, and this is because they have lost some amount of fat. So we usually tell the patients to try to lose fat, exercise, work on their chest muscles, and try to lose as much of that baby fat. Once they have reduced that fat, if you still notice a swelling underneath the nipple, then it is definitely gynecomastia. There is another section and category of young men who are bodybuilders and health fitness freaks, and most of them tend to take these steroid cycles, and gynecomastia is very commonly known to occur following this steroid intake. So we advise you to avoid these kind of steroids, and if you notice any lump or nodules underneath your nipple, chest area, it could be because of the steroids, and that is when you need to seek help. So to watch more informative videos on gynecomastia and other cosmetic surgery, do subscribe to our YouTube channel, Dr. Karishma Aesthetics. Don't forget to press the bell icon below and subscribe now.